This is for NSG310, Introduction to Professional Nursing. For our ethical scenario, we had the opioid crisis, the Needle Exchange Center. This is done by Adriana, Cade, Aaron, Joanna, and myself, Andrew, and I'll be presenting for the group today. So the overview of the crisis, according to the CDC, in 2022, 108,000 people died from drug overdoses in the United States. 82,000 deaths involved opioids, accounting for about 76% of all overdose deaths. The opioid crisis is a public health issue. It's caused by the overprescription of painkillers in the 1990s, causes over 100,000 deaths annually. HIV and Hep C contracted by the use of dirty needles. That is a big one that's still going on today, and that is one of the reasons that we are so cautious about needle sticks in the hospital. The overview of the needle exchange program created to stop the spread of infectious disease, create safe disposal of needles, allows connection for treatment and counseling, allows addicts to have HIV testing as well as Narcan to prevent an overdose. Some of the pros, reduce healthcare cost. A study by Rasaic in 2021 shows that there's a reduced cost for healthcare because needle exchanges are preventing the use of dirty needles, hence decreasing bloodborne infections. This led to the decreased contraction of HIV and treatment cost. Pros, disease prevention, increased access to health services, improved public safety, as well as the reduced healthcare costs due to the prevention of HIV. Some of the cons, encourage drug use. A 2022 study by Pacman found that NEP's programs allowed for a 21.6% increase in opioid-related mortality rates, meaning more drug users are using and overdosing due to the access of supplies. So some of the cons: encourage drug use, lack of funding, community pushback, and fear of increased drug activity. The group stance, same for the opioid crisis. Needle exchange, essential for the public's health. Alignment with the ANA Code of Ethics, we chose Provision 1 and 4. Provision 1, nurses must practice with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Drug addicts fall in this category, and it is our responsibility to treat these individuals equally and nicely. Provision 4, nurses have the authority, accountability, and responsibility for nursing practice, making decisions and taking action consistent with the obligation to promote health and to provide optimal care. One of the biggest things that we do in the medical world is education, just continuing education, whether that's for us or the patients or both. So a study from 2022 showed 18.2% decrease in HIV rates among people who inject drugs after NEPs were implemented. The needle exchange is not endorsing drugs, but reducing health risks. So some rationales of the group. Um, General group stance: nurses' responsibility to advocate for the patients affected by the opioid crisis, advocating for clean needles to prevent the spread of infection for safety. The Nurse Practice Act protects the public safety and improves health outcome through methods of proper disposal of needles and providing clean needles to reduce bloodborne illness. Some other rationales, cost-effective health strategy. Prevention is cheaper than treatment. The money going into providing clean syringes is significantly less than the money of treating diseases such as HIV and Hep C. That's simply because things like HIV, Hep C, those are just going to be ongoing treatments that people need the rest of their lives since there are no cures currently. So putting the money forward in order to implement some controls with the needle exchange program is going to be cost effective compared to treating these people long term. Some economic benefits for society: reducing disease transmission, increasing access to addiction. Treatment helps individuals recover faster and return to society and also their quality of life. We're also going to be reducing emergency room visits and overdosing. So, the overdose prevention education, train, recognize, and response to OD quickly in emergency. So, having that knowledge in order to get people help right away, instead of them being, down for a while and losing a uh, losing a lot of functions and stuff, and it's going to be more money and stuff if they're in the hospital longer. So that training, that ongoing education is great. And then early health intervention, the NEP offers on-site referral based medical care, and again, it's reducing the reliance on the emergency room and emergency departments out there that are just getting flooded with people. But if there's on-site referrals and stuff like that, people are going to be able to get help where they're at, hopefully. Just ending it with our reference page here as well. Again, this was for NSG 310, Introduction to Professional Nursing, and we did ours on the opioid crisis. Thank you.